Hi, my name is Anthony Zhang, and I'm a Yale Urology Research Fellow. I'm honored and excited to be sharing insight into Dr. Kim and Dr. Godesipor's apalutamide trial. For men with high-risk prostate cancer who choose prostatectomy, one of the biggest concerns remains what life looks like after surgery. For a full cancer removal, surgeons may hypothetically take a wider margin around the prostate, which may come at the cost of erectile function and urinary continence. Neoadjuvant hormone therapy has been studied for years, with earlier studies demonstrating that tumors can be shrunk and positive surgical margins reduced, yet no clear long-term improvement in cancer outcomes has been clearly delineated. And in our study, we evaluated apalutamide, a next-generation androgen receptor inhibitor, both alone and in combination with abiraterone acetate with prednisone and a GnRH agonist with a 3-month treatment course before prostatectomy. And the goal was to intensify the androgen suppression, hypothetically reducing the tumor size and ultimately making the nerve-sparing prostatectomy more feasible, leading to improved functional recovery after surgery. And we studied men with high risk localized prostate cancer, randomized 1:1:1 in 3 arms. Arm 1 being apalutamide alone for 3 months, followed by prostatectomy. Arm 2, apalutamide combined with abiraterone acetate with prednisone and a GnRH agonist for 3 months, followed by prostatectomy. And Arm 3, immediate prostatectomy without pretreatment. And what we found was encouraging that men in the combination therapy group, Arm 2, had significantly higher rates of potency recovery by 12 months compared to prostatectomy alone, Arm 3. And we also observed lower rates of positive surgical margins, indicating a reduced likelihood of residual cancer after surgery. And importantly, early cancer control measured by biochemical recurrence by 12-month follow-up was similar across all arms, suggesting no added expense of cancer control despite 3 months of neoadjuvant treatment. So, how might this actually help patients? One of the largest challenges with prostatectomy and high risk localized diseases that the surgeons may take a wider margin, which may involve nerves responsible for erection and urinary control. And what our study shows is that giving a short 3-month course of apalutamide based therapy can potentially change that, with suppression of androgen signaling and shrinkage or tumor downstaging prior to surgery. Urologists may better preserve neurovascular bundles, translating into improved functional recovery of potency and continence. As seen in this trial, men who received combination therapy had significantly improved potency recovery by 12 months compared to surgery alone, and patients receiving apalutamide alone demonstrated accelerated early continence improvement at 3 months. Of course, there are also some trade offs with 3 months of intensified hormone suppression prior to surgery than when compared against the prostatectomy only arm. However, most of these adverse events are manageable and low grade. In the combination arm, common side effects were metabolic and neurologic symptoms such as hypokalemia, headache, and change in taste. And within the apalutamide only arm, breast related side effects were common, including breast or nipple tenderness, with one case of gynecomastia. The reassurance is that these adverse events were generally temporary and manageable by supportive care. Only one grade 4 adverse event of hot flashes occurred within the combination arm, which resolved without long term consequence, and no adverse events led to any treatment termination, prevented them from prostatectomy, or caused any treatment related death. And overall, these findings suggest that a short course of apalutamide based therapy prior to prostatectomy may offer a meaningful way to improve the functional recovery without compromising early cancer control. Thank you.